Okay, I'll make a start. So hi, I'm just going to run through a lot of our TDAS services. My name's Jenny Campbell. I'm the Volunteer and Training Coordinator for Trafford Domestic Abuse Services. So a little bit about who we are. So Trafford Domestic Abuse Services is a registered charity. We've been around for about 30 years now, and we support both individuals and families who have experienced domestic abuse. So we work with both those who may have experienced some historic abuse or those that might be experiencing current abuse, and we work with a range of risk. We support both adults and children who are victims of domestic abuse, and there needs to be a locality around that. So we support those that either live or work in the Trafford area. We do a lot of intervention and prevention services, and we work in partnership with other voluntary organisations to support families across Greater Manchester. So we do a lot of prevention work in schools, like raising awareness. We do a lot of training around raising awareness, and we offer a lot of interventions, which I'll go through shortly. And our vision really is to eradicate all forms of domestic abuse and basically create a society where it's not tolerated and families can live safely. And our mission is to enable people to break free from domestic abuse. So one of the first services that we have is accommodation. And when I talk about accommodation, I'm talking about our safe houses or our refuges. So they are seen as safe and secure accommodation for people who are fleeing domestic abuse. So they're emergency accommodation. They're usually considered for those that are at high risk and need to flee. We take people from all areas across the UK. They don't have to live in Trafford. And usually we would say that we'd recommend that they would live somewhere slightly outside of the Trafford area. And that's just down to safety, but it's dependent on case by case. So the accommodation is not just about housing. Our staff really seek to empower victims of domestic abuse to kind of take control of their lives and make a lot of life-changing decisions. And we ensure that we have a very supportive and educative environment. We establish a lot of links within the community and with partnership agencies. And so we network a lot of the time to just basically ensure that we're offering and providing a really person-centered service that's tailored to kind of all the individuals and families' needs. And we know that fleeing domestic abuse and arriving at a place where you don't know anyone can be a really difficult time. So we do all that we can to support our residents, ensure they kind of feel safe when they arrive, and we help them settle in. So we do a lot of welcome packs. We provide toiletries, duvets, pillows, bedding, food, toys, teddies for any children. And then throughout the year, with lots of support from volunteers that I work with, we celebrate a lot of like culturally relevant events and religious holidays, and just kind of ensure that despite all the upheaval, the residents can kind of still enjoy these key moments. Staff are available from Monday to Fridays, 9 a.m. to 5 p.m. And the support provided is kind of a mixture of scheduled and weekly support sessions, some informal kind of ad hoc support as needed. And refuge residents usually stay for about 6 months, by which time we as a service kind of aim to provide a lot of support ranging from kind of peer group support. They might attend one of our courses like True Colours, and then we'll kind of connect them into like local groups of interest and help them really access any other services like schools, doctors and benefits. So here are some of the refuges that we have. We have Phoenix House, which houses 6 families, Lotus House, which is for 6 single women, Blossom House, which is 5 families or women with one child. We have Oak House, which we've just opened, which is for men, so we have 6 single men. And we have a complex needs house as well, which can be either 2 single women or 2 women with children. And we have the dispersed properties as well. So these can be used for families with older children. Often boys of a certain age can't come to refuge, so dispersed properties work to support particularly families with older boys within the family. And then we have our 9 move on properties as well, and that's for those that are moving on from refuge and are looking for sort of more independent support. So those sessions are more ad hoc, they're less kind of maybe weekly, so it's kind of as and when the service user feels they need the support, and it kind of creates this level of empowerment and independence that they need before moving on into independent living. So we have our community support. The first being our IDVA services. IDVA stands for Independent Domestic Violence Advocate. And basically they work with the high-risk victims. All those referrals come through MARIC. We might also support those that kind of come through the helpline, but usually those that are high risk will come through MARIC and then be supported through an IDVA. It's a completely voluntary service, so it's up to the service user if they want this type of support. Independent domestic violence advocates act as the victim's first point of contact. They address all those immediate safety concerns. So they look at target hardening, changing locks, potentially calling the fire service to kind of help with a more secure letterbox in case of arson. And then they support victims to navigate the civil and criminal justice system. So it might be around only getting any of those injunctions and looking at safety planning. And they're basically the voice of the victim at any of the kind of MARIC meetings. MARIC meaning Multi-Agency Risk Assessment Conference. And they'll advocate for that victim, and they'll kind of put across their views and what things they're hoping from other services really, and what support they require. We also have our domestic abuse surgery, and this provides up to 6 sessions of emotional support and constructive advice for those that have previously or have previously experienced domestic abuse. It's appointment-based, and it offers face-to-face contact basically at our services. So the service kind of involves active listening, supporting and understanding the dynamics of domestic abuse, providing information around domestic abuse, and then referring and signposting to internal and external services, offering lots of proactive advice, and then kind of exploring the options with the victim. And then we have our community outreach. This is longer term support for medium risk victims. They provide a lot of emotional and practical support, and then other services are often involved, and that's usually kind of at the child in need level. So that's why that kind of medium risk is there. And then we have our outreach and specialist support. So our homelessness MODA meaning Move On Domestic Abuse Advisor. They're there to really provide specialist trauma-informed support services for individuals and families on a one-to-one basis, providing the interventions needed to prevent them from becoming homeless and to kind of resettle them into new accommodation if that's something they require. And this can involve kind of providing information and guidance, a lot of practical support, safety planning, risk management. They do a lot of advocacy and emotional support, and their support's really tailored to individual needs to ensure the most positive outcomes are achieved and the risk of them becoming homeless is reduced. And we work really closely with HOST, which is Housing Options Service Trafford, and other local housing providers. And then we have our male domestic abuse advisor. We offer this support to male victims of domestic abuse, but what we found is women victims are also quite open to having a male DA advisor. It's kind of, now that we have this option, is really, really beneficial for a lot of people. And we also now run a male True Colours programme as well, as that was an identified need, a group programme for men. We also have the Make a Change programme. It's a new programme. I say new, it's been around for about 2 years, but it's there to help those who are experiencing unhealthy relationships and kind of recognise that they need support to change certain behaviours that they have, and ensure that the relationship doesn't become abusive in the future. So it's quite lower level, we'd say kind of standard risk and like very early intervention. So it's an initiative in partnership with Talk, Listen, Change. Talk, Listen, Change deliver the support to those who are showing those abusive behaviours or those harmful behaviours in their kind of like intimate relationships. And then TDAS offer that very separate but very confidential support to partners and ex-partners. We also provide support to the children as well within that family. So it's a very holistic approach to domestic abuse and kind of that very early intervention. And then we have the Advise programme as well, and that's for supporting sexual clinicians to kind of really identify and respond to individuals affected by domestic abuse and sexual violence. So they're kind of there to offer training and support to health practitioners and kind of give guidance around a lot of our toolkits and kind of support around that approach to talking about domestic abuse. And we work in partnership with Women's Aid and Jigsaw Support as well. So we also have some groups that we run for our adults. So we have True Colours, which is a 6-week programme. It gives information support to basically support victims around the realities and the effects of domestic abuse. The programme runs for about 2 hours a week. So at the moment, it's facilitated by women, but we also facilitate it for men as well, and the male DAA works with them. It's really a safe space for victims to come together, learn more about the effects of domestic abuse, and often women who've attended this course really find it really beneficial, and really helps them kind of understand the complexities around domestic abuse and sort of identify unhealthy relationships and kind of learn strategies to protect themselves in the future. And it's open to those that are kind of living or working in Trafford. And then we also have Back to Me. And the point of this course is really to kind of understand the dynamics and support them around kind of like personal development, and kind of, again, understand the realities and the effects of domestic abuse. It runs for 1 hour, a 1 3-hour session. So it can be on various topics. So it can be on communication skills, confidence building, goal setting, kind of like how to be assertive. And yeah, again, it's open to those that are living or working in Trafford, and it's free of charge. We have our victim voice facilitator. So we recognise that with the kind of Domestic Abuse Act, that there's now obviously a duty that's been placed on local authorities to kind of have representation of the voice of victims and children and young people. So it's kind of that way of kind of understanding victims' experiences of services, and get feedback, really, so that we can kind of support future developments. We do lots of kind of community hubs, online surveys, feedback questionnaires, and do lots of kind of one-to-one sessions with victims. And basically just trying to constantly review how we reach victims and then share their views to kind of develop services in the future and create a better response, basically, to domestic abuse. The REACH project. So we have a diverse communities domestic abuse advisor, a complex needs domestic abuse advisor, and a young person's domestic abuse advisor. They have varying sort of like support on what they do, and it's about really addressing those with certain vulnerabilities. So recognising kind of like the toxic trio and the impact that mental health and drug and alcohol use can have on victims. So they'll work at identifying those barriers that victims kind of face to accessing support. With the young persons, it's around recognising younger people are a lot more vulnerable to domestic abuse and don't really have a lot of resources when it comes to kind of leaving those relationships, and also about kind of improving their understanding of healthy relationships. For a lot of young people, it's their first relationship and might not have anything to kind of go on from there. So their role is really to support young people kind of at that point. And our diverse communities is kind of recognising those from minority backgrounds who are kind of fleeing their home due to domestic abuse. So they do a lot of trauma-informed and person-centred work for those that are living in our accommodation settings. They do a lot of language support and managing finances, do the safety planning and emotional support and child contact arrangements, conversations. Then we have our children and young people service. So we have Our Space. Our Space is now our main referral pathway for children and young people who are accessing the service. Basically, this creates an assessment period so that we kind of get a better understanding about what the child needs. But for those that have experienced historic abuse, it might be just really appropriate so they get some kind of DA awareness, domestic abuse awareness. So we have, it's a 6-week programme, and it's accessible for children and young people aged between 5 and 14 who live or go to school in Trafford. It touches on a lot of different areas, and they're split into kind of different age groups. So we have a 5 to 7 group, an 8 to 11, and a 12 to 14. And like I said, they explore different topics each week. So we'll always touch on domestic abuse, give that opportunity for children to kind of understand their experiences and what's happened. And then we'll always look at kind of safety planning so that children, if they're in that current abusive situation, they understand how to keep themselves safe. But if anything was to happen to them in the future, they would also have that understanding as well. We do a lot of emotion work because we understand a lot of young people and children have quite varying experiences of domestic abuse, and this has very different kind of impacts on their behaviour. So we support around kind of their worries and their anxiety. We also do a session on anger and look at how kind of healthy ways to express this. All the children kind of provided with snacks, and it's run after school. And we have our one-to-one support as well. So for those children that maybe have been identified through our referral pathways needing additional support, they can go through our one-to-one support. Or it might be children that we may have noticed that might need more kind of specialist intervention. Maybe they're at current risk and there are serious concerns. We would look at doing one-to-one support straight away. So that's up to 8 sessions for children, and they're aged between 5 and 18 years old. And that could be that they have a lived experience of domestic abuse or have been in their own abusive relationship. The one-to-one support we deliver in school the majority of the time, but we also look at community venues, or sometimes the children come to the TDAS offices after school. We also offer refuge support for children and young people, and that can look like a lot of emotional and practical and resettlement support. We do a lot of kind of play sessions, family sessions, one-to-one support. We also deliver some of the group programs within the refuge, like our space, and offer some parenting support as well that's very more specialist around domestic abuse. And we do lots of kind of trips and activities for the children, which is really fun and exciting. And we do source a lot of kind of school and nursery places if needed, and resettle them, which kind of can be quite a stressful period for parents. So we work really hard to do that. And then we have our family support. So for those children that have kind of left the environment and they're no longer with the abusive parent, we work really closely with the non-abusive parent to kind of support them around understanding boundaries, understanding attachment, kind of repair that bond and that attachment following the abuse. So the sessions are around 8 sessions, and the family support worker will kind of meet with children individually and parent and kind of bring them together as a family and run some family sessions. And our school offers, like I mentioned earlier, so we have Speak Out, Speak Now, which is a 6-week programme, and it's delivered in schools for young people aged 14 and over. And it really aims to provide awareness and an understanding of domestic abuse and healthy relationships. So this is a lot of the preventative work that we're trying to do, and speak to children at kind of a young enough age, really, to kind of get those conversations going and give young people the information and tools so that they can keep themselves safe and understand the relationships that they're building now at this time. We also know that schools kind of can't always commit to the 6 weeks, so we offer a 1-hour healthy relationship workshop, and we can kind of do this within an assembly, something like that. But we do it across high schools and any kind of community centres across Trafford, and they're an hour long. We also do our drama and workshop and teacher training. So we do specific training for teachers so they can kind of spot the signs of domestic abuse and know how to kind of deal with disclosures and how to kind of act on them. And then the young people are kind of given a drama performance to kind of understand domestic abuse and teenage relationship abuse, and just kind of bring those things to light for them. And last but not least, we have branched out. So we're based in Trafford, but we're also part of the Safe in Salford partnership. And Safe in Salford is basically the one front door domestic abuse support for Salford. And TDAS works in partnership with a lot of specialist organisations to provide this support across the city of Salford. So there's 5 elements to the partnership. TDAS are involved in the crisis service. So we have IDVAs, or independent domestic violence advocates, who support high-risk victims in Salford. There's the advice and support services for victims, which is delivered through Salford Foundation, that community support and longer-term support, as well as the helpline. Then we also have the specialist support for GPs, and that's known as IRIS. And that's through the Pankhurst Trust, and those IRIS workers support around training GPs and kind of have their base within GP surgeries, or kind of offer that support to victims that are coming through surgeries. And then TDAS also have the children and young people support, which is Harbour. And again, it offers very, very similar support to what's offered by TDAS's children and young people support. So doing one-to-one work, family support, running groups. On the additional side of that, Harbour also offers counselling to children and young people, as well as support to children and young people who are displaying harmful behaviours, and that might be towards peers, it could be towards parents, it could be towards siblings, but they follow the Respect programme and offered a lot of group intervention as well as one-to-one. We also have the behaviour change programmes for perpetrators, and that's delivered through Talk, Listen, Change. Sorry, I forgot to mention as well that Harbour is a partnership within a partnership. So Harbour is a partnership between TDAS and Talk, Listen, Change. And they offer the counselling side and young people who harm support. So yeah, like I said, the behaviour change programmes for perpetrators are all delivered through Talk, Listen, Change. And here's just a bit of information about our domestic abuse training. So like you come on today, we've got the lunch and learns, which are around 30 minutes to 45 minutes. And they can cover a range of different topics, both kind of like adult support and children and young people support. But we kind of break them down into different areas like coercive control, victim blaming and myths, thinking about the voice of the child and attachment. And then we do kind of more in-depth practical support, so how you actually support victims and survivors. So we do a more in-depth training around civil orders and the criminal justice system. And if you're feeling like you don't know much about kind of the DASH and doing the risk assessment, we also deliver that training. We also have a training around the Marek process and Clare's Law, so if you wanted to know a little bit more about that. And we also offer much longer training as well for professionals, which kind of involve a lot of these different elements like the DASH and thinking about safety planning, as well as some overall just general awareness if you feel like you need it. And we run those once a month at the end of each month. Thank you for attending today. I don't know if you've got any questions. I'm more than happy to take them.
I've not got any that I can think of. It was really